Yeah, so the prostate is actually an organ that's only found in men. It sits just below the bladder. The bladder is the organ that produces urine, where the urine comes from. Just below the bladder is the prostate. And what the prostate does, it is the organ that actually produces semen. Yeah, that nourishes the sperms. Yeah, so that's what the prostate is.
Okay.
Yeah, and it surrounds the urethra. The urethra is the pipe or tube that takes the urine from the bladder,
yes,
out of the body through the penis.
Yeah.
So the prostate is actually quite inside the body. You can't feel it yourself. A doctor, however, can feel it if they put a finger, what they call a digital rectal exam. If they put a finger at your backside into the rectum, they can actually feel the prostate and see if it has any features that might say that you do have prostate cancer. So that's called the digital rectal examination. Another test is called the PSA test, which is a blood test. In full, it's prostate specific antigen. Yeah, so it's a blood test, and then the lab will analyze that blood, and if they note that there are high levels of this prostate specific antigen, it means that you could have prostate cancer.
The chances are higher.
The chances are higher that you could have prostate cancer. However, further tests need to be done. One is the same digital rectal exam, where we'll feel the prostate. Another thing is a biopsy of the prostate, which will actually prove that either you do have prostate cancer or you don't have prostate cancer. But the blood test, yes, it's a very simple procedure. It's just getting blood, and then within a few minutes you get your results. So the regulations in Zambia is that every man above the age of 45 should have this prostate specific antigen test.
Yes.
That will be able to detect, that will help with detecting the disease very early, before you even have any symptoms whatsoever. Because as with most cancers, the earlier a cancer is detected, the more likely you are able to cure it. Prostate cancer is actually curable if it's found early, and that's why it's important to go for screening rather than wait for symptoms to appear. In addition to catching it while it's not yet detectable, as in you don't have symptoms, you might have symptoms, but obviously we don't want you to reach the stage of symptoms.
Absolutely.
We want you to screen first before you reach the symptoms.
Yes.
But the symptoms would be, most of the time, it's urinary problems. These can be, you go to the toilet very often to urinate, or sometimes when you go to urinate, you are unable to it's very difficult to urinate, what we call hesitancy. You feel that you want to urinate, but when you actually go to the toilet, the urine is not coming out. That's what we call hesitancy. What we call incomplete voiding, like you feel that there's still some urine left in the bladder, but you're unable to let it come out. And occasionally also you might have blood in the urine.
And also, what about going to the toilet more frequently?
Yes, also going to the toilet more frequently, and especially at night. And when the cancer is spread, obviously we hope that nobody would reach that stage, but it does happen. When the cancer has spread, most of the common symptoms are backache, pain in the hips.
That's
because
a sign
then it
that
has
it's spread
to the bones.
I see.
Yeah, so there are some things that we can do to reduce our risk. Probably not eliminate it completely, but we are able to reduce our risk. One thing is generally living a healthy lifestyle. One, by eating lots of fruits and vegetables, a high vitamin intake, a high fiber intake, exercise. And the things that we shouldn't be doing is living a sedentary lifestyle, having a high fat intake, which might come from lots of meat. So a low fat diet, high in vitamins, fruits, vegetables, would reduce our risk.
Thank you very much for your time, and we've got lots of patients to attend to. We'll let you get back to work.
Thank you.